Diabetes is a chronic health condition that affects your body's ability to regulate insulin. Insulin is the hormone that regulates the level of sugar in your blood at any given time. There are two different types of diabetes. There's type 1 diabetes, which is an autoimmune condition, where your body is unable to produce any insulin at all. Then there's type 2 diabetes, which is a metabolic condition, which affects your pancreas's ability to use the insulin properly. Type 1 diabetes is an autoimmune condition, meaning that the body cannot produce any insulin at all. It also means that diet and exercise cannot cure this type of diabetes. This typically occurs when the immune system destroys and attacks the cells in the pancreas that are used for producing insulin. It's typically diagnosed in children and youth, but can be diagnosed at any age. Type 2 diabetes is a metabolic disorder that is commonly found in people who are overweight or physically inactive. This type of diabetes can be controlled with diet and exercise, unlike type 1. This occurs when the pancreas does not produce enough insulin or does produce enough insulin but is unable to properly use it. Type 2 diabetes specifically can be managed very well through diet and exercise. Eating the right foods will reduce your blood sugar level and also reduce the need for any insulin injections or other diabetes medications. The proper amount of exercise will help your body regulate the insulin that it is producing. By doing both of these, you can manage your type 2 diabetes or even prevent it altogether. There are many benefits to exercise for people with diabetes, whether they have type 1 or type 2. Exercise can be just as effective as medication for people with type 2 diabetes and can even prevent the need for any medication at all. Regular physical activity will help control and reduce your blood sugar levels, as well as your blood pressure. It can even reduce the risk of any heart, eye, kidney, or any other complications that go along with diabetes. It can also help you manage and control your weight. The Canadian Physical Activity Guidelines are considered appropriate for most people with diabetes, given that they have no diabetic complications or any other chronic health conditions that go along with diabetes. These guidelines state to aim for at least 150 minutes of moderate to vigorous aerobic activity and resistance training at least 2 to 3 times a week. Aerobic exercise is considered any type of continuous movement that will result in an increase in your heart rate and breathing rate. It is recommended that people with diabetes participate in aerobic exercise at least 3 to 5 times a week at a moderate intensity for 30 to 60 minutes. Types of exercise that can be participated in can include swimming, running, biking, walking, jumping rope, or anything else that will result in the raising of your heart rate. It is also recommended that people with diabetes participate in resistance training at least 2 to 3 times a week. This can be done at a low to moderate intensity, which is around 30 to 40% of your 1 rep max, by doing 1 to 3 sets of 8 to 12 repetitions of every major muscle group, making sure to leave at least 48 hours in between sessions. Any person with diabetes, whether it be type 1 or type 2, should consult a doctor before participating in any physical activity at all. Make sure to monitor your blood sugar before, during, and after exercise. Recognize the signs of hypoglycemia, meaning your blood sugar drops below a 4.0 millimoles per liter. Consider wearing a medical alert bracelet or necklace in the event that a hypoglycemic episode does happen or you happen to be hypo unaware. Also, completely avoid exercise at all costs if you do have a low blood sugar. Safety considerations for persons with diabetes who will be exercising include always having a source of glucose or carbohydrate nearby, or glucagon if the person carries it, in the event that a hypoglycemic episode were to happen while exercising. If this happens, remember the 15 by 15 rule by taking 15 grams of carbs every 15 minutes until your blood sugar returns to at least a 4.1 millimoles per liter or higher. Other considerations to be taken for safety are to strategically plan when you eat, take insulin, or any other medications, and what time you exercise at. You should also remember to exercise in a cooler environment, as persons with diabetes are more prone to hypoglycemic episodes in heat. Warming up and stretching is important for anybody about to exercise, whether you have diabetes or not. For a person with diabetes, it is important to warm up for at least 5 minutes, as it warms up your bones, your muscles, and your ligaments, and reduces the risk for injuries that you may not be able to recover from as well as a diabetic. It also allows your pancreas the time to regulate the insulin and glucose levels needed as your intensity increases, preventing hypoglycemic episodes.
We have chosen to adapt a push-up for people with diabetes. The adaptation is for the client to do the push-up off their knees rather than on their toes. By doing a push-up on their knees, it makes exercises easier for people with diabetic neuropathy. Doing a push-up on their knees allows them to still strengthen their deltoids, pectorals major, and tricep while refraining from using their feet. Using large muscle groups in their arms improves the body's way of using glucose in response to insulin. To do this exercise, have the client lie supine on the ground with their hands shoulder width apart.
We have chosen to adapt the plank for clients with diabetes. The adaptation to the plank is to do plank on their knees rather than their toes. Having the client lay on the floor with their elbows under their shoulders, hands flat on the floor, and their core engaged, they keep their forearms and knees on the floor and raise their body slowly upward until their body is in a straight line, but still having their knees bent and in contact with the floor. Holding this position for 30 seconds for each set. The muscles that are worked during the exercise are the rectus abdominis, transverse abdominis, and erector spinae. Using these muscles regularly reduces blood pressure and blood sugar as well as the risk for abdominal obesity while also making it easier for the body to use insulin. We have adapted the exercises to be on their knees instead of their toes for persons with diabetes who experience symptoms of diabetic neuropathy.
We have adapted this exercise by adding a chair or stairs underneath the person for added support in the possible case of neuropathy or hypoglycemia. Have the client stand in front of a chair or step-up boxes. Slowly sit back into the chair without actually sitting and tighten your abdominals to support your back. Keep your knees in line with your second big toe and place your weight in the middle of your feet. Placing your arms out in front may help with balance. Lastly, straighten your body upright and repeat. The muscles that are being used include the gluteus maximus and quadriceps. Squats are a compound exercise, resulting in working multiple muscles and joints at the same time. The large muscles used while doing a squat require a large amount of glucose from the bloodstream. Working on them on a regular basis will increase insulin sensitivity.
The muscles that are used while performing a crunch are the rectus abdominis and the internal and external obliques. Using these muscles regularly will reduce the chance of abdominal obesity, which is the number one cause of type 2 diabetes. It will also improve the pancreas's ability to produce insulin and the regulation of insulin throughout the body. To perform this exercise, first make sure that the seat's height is adjusted to your body so that your shoulders rest back comfortably against the padding. Select the weight load that you like to use and insert the pin into the machine. It is generally recommended that you use a very low weight to start. Going into the exercise, flex the core, push against the padded lever, and bend forward at the waist. Your hips should stay in the seat at all times. Moving in a slow and controlled manner, remember to breathe in as you come back up to the starting position to finish the exercise. Muscles that are being used while doing a bicep curl include your brachialis and your brachioradialis in your lower arm, and your biceps brachii in your upper arm. These muscles are used every day when picking objects up off the floor or really lifting anything. By strengthening these muscles, it will reduce your blood sugar levels and aid your body in insulin regulation. By doing this exercise seated, it reduces the risk of hypoglycemia and lessens the symptoms of diabetic neuropathy. To do this exercise seated, sit on the workout bench with a dumbbell in each hand down at your sides. Slowly raise your arms past your chest toward your shoulders. Once you reach your shoulders, pause for a second to contract your bicep muscles and then slowly lower your arms back down to the starting position.
Exhale as you raise the dumbbell by extending your elbows. Inhale as you lower the dumbbell to the starting position by flexing your elbow. Repeat after desired sets and repetitions are complete. The muscles that are used in this exercise are the triceps brachii. Much like doing bicep curls, tricep extensions can be adapted in the same way, by being seated. It also allows a person with diabetes to reduce symptoms of diabetic neuropathy, reduces the risk of hypoglycemia, and allows the person with diabetes to still strengthen the upper body muscles.